Hi, welcome to the Vitality Hours channel, and I'm Nadia, a mother of two, which is an important introduction today because we're going to talk about the 5 main concerns that every new mother has. Everybody tries their best with nutrition, keeping fit, and you take out that little time for self-care. But as Dr. Geetika, who's a very popular dermatologist from Isaac, knows, that's always difficult for a new mother. So Dr. Geetika, going to the first problem, which is very common and the first thing that comes to your mind is of course stretch marks. I know everybody tries really hard with the creams, shea butter, oils. Why do we have them?
Yeah. So yes, stretch marks is something one or the other woman has faced them, and it's just not during pregnancy, it's also during your puberty or adolescence, or when you gain or lose weight all of a sudden. So the best preventive point would be, yes, to gain your weight more slowly and steadily, because that is what is happening. The elastic fibers of the skin is getting stretched and torn, and those marks that you see, the stria or the stripes, those are actually the scars which are left behind during the tearing of the skin. So you can gain your weight slowly, steadily, lose it slowly, steadily, and of course hydrate your body well. So we're talking about all those creams, shea butter, avocado oil, wheat germ oil. These are all helpful in making your fibers more nourished and not letting them get torn too easily. But if your mother has stretch marks, you are likely to have stretch marks.
That's a dreaded one.
Yeah, so that's always a thing. You can look back and ask your mom. But you can prevent them doing all of this. And once they are there are two kinds of stretch marks. There are white stretch marks, which are silvery, which are old. And there are new stretch marks, which are more red or purplish in color. So red and purplish
which
stretch
is easier
marks,
to get rid of.
Yes, so the new stretch marks which are red or purplish are more easier to treat. But if you're pregnant or you're lactating, then my treatment, which involves some topical creams, it is much lesser. I would still tell them to go easy on their weight gain and apply lots of shea butter or avocado oil on all these areas at least twice in a day.
And all of this, I'm sure, like just having really high antioxidant and vitamin E content, ingesting it, I think would also help, right? Inside, outside.
So it's also genetically prone, but yes, you can make your collagen more stronger by doing all of this. And once it's there and they're white in color, you can fade their appearance. So there is no treatment available which will eradicate them 100%, but you can fade their appearance and make it more comfortable when you look at them. So about 60 to 70% of good reactions I've seen. At Isaac, we do a treatment which is called stretch mark erase. So we do a treatment which is combining lots of treatments, which is chemical peeling, Dermapen and PRP. So when we do all of these treatments in synchronized manner, you see a lot of good difference. So new
so
collagen
percentage, like you said, that it might not always be possible to get rid of them completely, but like I'm sure there's like a range, a percentage
60
range?
to 70%. So we
better.
do this treatment which helps in collagen to regenerate, to have the new fibers come in, and what it partially does, it makes the appearance of the stretch marks more palatable and less obvious.
Okay, so I think collagen, omega-3s, vitamin E in your body is a good thing, and then of course you have a little bit of treatment to help you.
Yes. So treatment of stretch marks, definitely starting with prevention, we go on to treating the white stretch marks or the pink stretch marks. So if a patient is coming to me has pink stretch marks and is not lactating, I would give them a retinoid cream to apply.
Okay.
And if the patient is lactating, then I would just ask the mother to relax and be patient and come back to me when the lactation has stopped.
So treatments are recommended once, obviously, you've stopped lactating.
Yes.
Post breastfeeding. Okay. Also, how long is it something that a person sees results in? 1 time, 5 times, 10 times? Is it painful?
So the Isaac erase treatment for stretch marks involves 2 types of treatments. We do a fractional laser together with Dermapen and PRP. So what this laser does, it is sending micro beams of laser into the tissue to form coagulation and give more hydrated collagen back. So this treatment is done once in a month. We numb the area so that you don't feel any pain. There is a little bit of downtime, which can be like some scabbing, But it's usually not a problem for the patients because that is at the areas where it's not visible. So scabbing is there for about 2 to 3 days. If it is on a exposed area, we tell them to put a sunblock and you're good to go back home after the treatment. And this is combined with another treatment which is dermapen, also called microneedling, with PRP, which is platelet-rich plasma. So platelet-rich plasma has been widely spoken about by the celebrities who have taken it on their face and hair. But when
Just
it
the
is
one where they sort of take the blood from somewhere and then put it where they want more circulation.
So we are taking out the growth factors from your own blood and we're putting it back into the tissue, that scarring tissue, the stretch marks, so that it heals better.
Sure.
So we are combining here about 2 to 3 most upgraded treatments to give you the best result. We are giving a timeline of sessions about 4 to 6, depending on the area to be treated.
4 to 6 is when you should see a good difference.
And the patient should be coming to me at least twice in a month.
So
once I'm doing a microneedling procedure with PRP, and once I will be doing the Fraser, which is the fractional laser treatment. And within 4 months is minimum that a patient can start seeing the results, and 6 months is the maximum timeline that I've seen for patient to get a good result. Yeah, absolutely.
Perfect. Actually, that brings me to my next question, or not my question, let's say the second area of concern, because you spoke about PRP, is I've heard about PRP basically being used for hair growth. So there's a lot of hair fall, especially once you finish lactation. So it's again like a new mother problem. So is that something again that you use for getting hair growth back?
Sure. So hair fall is a very regular concern. I think all of us lose about 10% of hair every day anyways.
That's scary.
But during pregnancy, you see a heavy, thick mane of hair. Like you have your strong nails, your hair are thick and lustrous, and suddenly that hair fall stops. So why does that happen? It happens because during pregnancy, your estrogen is high, and estrogen is putting those hair in the resting phase. And those resting phase hair don't fall, so your hair are staying as it is. So this good part of hair actually is good for your head, but you can also see hair on your body getting more in number and quantity. On your face, on the back, you can see some hair growth, but this hair growth will kind of come down or calm down after 3 to 4 months of pregnancy. So a lot of women think that it has something to do with lactation, but it is actually the hormones which are playing the havoc. So after 3 to 4 months, when the hormones are getting back into the sync, those resting phase hair are going to go into the falling phase. And that is when you can see a lot of hair fall, which can be up to 200 strands per day, and lumps of hair can also fall. So I ask my moms, my new moms, to be patient again, have a balanced, healthy diet, which they're already doing. But this is a phase which you should be well educated about.
So it's usually the hair comes back most times.
Yes, but that hair fall period has to be well known. That this will
well known, and you should because I'm sure the stress. If you get stressed about it, it's going to cause more hair fall.
Go for a good haircut. Avoid getting any extra chemical treatments on your hair because all of those will not help. You can definitely start using good supplementation. Don't start those supplements. You can go in for treatments like PRP. We were talking about PRP for hair loss. It works amazing.
But is it too early to start, or is it only when the hair loss persists for some people?
So we are going to do a blood check for all the women, for all the candidates who are coming, to understand if the hypothyroidism is there or some deficiencies are there, because my treatment would depend on that. But PRP so far has stood out to be a good treatment for all of these problems.
So all hair concerns.
Exactly.
Skin.
So PRP is actually platelet-rich plasma. We take a little bit of blood from you. It sounds scary, but it's just about 5 ml to 10 ml, the blood that you give when you're doing your blood test. So routine blood test, that amount of blood. Then we have a centrifuge machine which is inside our center, right there. You can see that we're preparing the PRP right in front of your eyes. The blood is not sent out somewhere, it's your own blood.
Because a lot of people, I think, get freaked out by the idea of, taking out blood, you're used to it because of to put it back.
Exactly. So that's what we believe in, that everything should be happening in front of you. It's your own thing. So that blood is then centrifuged at a certain rate, and then we drive out the platelet-rich plasma, which is also called the golden plasma because it's yellow in color. It's rich with growth factors, it's rich with stem cells, it's rich with fibroblast, it's rich with everything good. So that we can actually use as a fertilizer
So
for our
on your
scalp.
skin, your scalp,
Yes.
anywhere you have a concern.
Absolutely. So for the scalp, it can be a fertilizer. For your skin, it can be growth factors and to nourish the skin.
Collagen, does it help with
Yes,
collagen production?
absolutely. And for your tummy, for the stretch marks, it's also going to heal those stretch marks.
Sure, and I think you spoke about hormones going haywire. So,
Yep.
so I'm sure besides supplements, I mean, of course, like a supplement, I'm sure there's some herbs that you can help with that sort of help you post
See,
natally.
herbs, I would go only with a certain certified supplementation after knowing if there is a deficiency or not. Because I strongly believe on not over supplementing a person if you are not deficient in something. Because most of these vitamins are water soluble. If you're just excessively intaking them, they're just going to be drained out of the body. So might as well give your body what it really requires. And this PRP treatment that we were talking about, it's done once in a month for at least 4 months together. So you have to do that entire cycle to get a good result. And post that, you have good hair growth.
Yeah, and personally for me, I think protein and amaranth greens like chulai juice
Yes, of course.
helps amazingly for hair growth.
So I love chulai laddu myself. Amrit
Laddu?
laddu. Yes. So my
Okay.
mom has been making it forever.
Yeah.
Me, my daughter, who's 5-year-old, it's her morning snack or evening snack too. It's heavy with protein. We just mix it with a little bit of milk or even almond milk, and it goes wonderful.
Perfect. Okay. So that brings us to my third problem, which is skin changes while you're pregnant. So a lot of girls I noticed get a lot of acne. For me, I got a little bit of pigmentation in this area. So is there something we can do about that?
So skin is your largest organ of the body, and during pregnancy all the hormones are changing inside and you are more sensitive to sun exposure. We all know that sun can cause extreme damage to the skin, but during pregnancy it is all the more sensitive. So we tell our patients during pregnancy that the kind of products they should be using, they should be different than what they were using previously.
Sure.
Sometimes overactivation of the oil glands happen. Sometimes your skin is getting more damaged due to the sun exposure. You might end up having more sunspots. Sometimes even women
But that's
have...
strange because many times you're told to sit in the sun because of vitamin D while you're pregnant.
So that's only 5 minutes of sun exposure.
Okay.
So that
Only 5 minutes
yes,
is good.
And that to morning sun, between 4 to 5 o'clock, that orange sunlight, that is all that
4
you
to
need.
5, that's all.
If you just sit out and you're bathing in the sun, you're just getting tan, that's all. And getting more tan, getting into the treatment.
And then pigmentation, yeah.
Of course. So I was talking about the issues to the skin.
Sure.
So talking about that, acne, oversecretion of the sebum. Second is the sunspots. And third, which is the worst, it's called chloasma or the pregnancy mask. So what it is exactly is you get pigmentation, hyperpigmentation around your nose and the cheeks. It's bluish purplish in color, and a lot of women
Mine
are
is not blue purple.
No,
I think it's
thankfully
like
not.
light
Yours
brown.
is just sunspots. So that is also driven by genetically. If your mother has
Yeah, my
that,
mom
you
had
have.
them.
Yeah.
True.
So these are the 3 things that I have seen in my practice are happening more so. So we can all regulate them. We can't overtreat them. I cannot give retinoids or certain antibiotics to be put on the skin
So
while
that was
you're
my
pregnant.
second question. So while we're pregnant, you don't think we can do too much? Or what can we
Yes.
do while we're pregnant?
Yes.
And then of course, once
So first thing, go and see your dermatologist if your skin is getting changed. And anyways, your skin regimen has to change. You have to see your dermatologist to change that. Sunblock is even more important during pregnancy. Sunblock to be applied SPF 50, water resistant or sweat resistant if you're going out in the sun or you're working out or running in the sun every 2 to 3 hours.
Okay.
Yeah, so these days I'm having patients who are talking about natural sunblocks. They're saying, oh doc, we just want natural sunblocks, organic sunblocks.
So are there
these,
options?
yeah, so these sunblocks but haven't been studied scientifically.
Okay.
We don't know how effective they are. Even though they might say they have a SPF of 50, they're not dermatologically recommended. They have not been studied. So rather go with options which are well studied.
So there's no natural one that you recommend or you had a good
would say-
experience with?
So a natural one might have more physical sunblock, which is zinc oxide, which gives
Sure.
you that white appearance. That is what is causing a physical sunblock from the sun. But as natural as you can go, you can wear a wide rimmed hat. You can wear clothes which are more covering your body, like full sleeves. And whenever you're going out, make sure you wear sunglasses to protect your periorbital area. But sunblock, even then, remains most important. Half an hour before stepping out in the sun, and every 2 to 3 hours when you're out in the sun. So that is my giveaway that sunblock is most important. And second,
For your
in
skin during
yes,
pregnancy.
Yes.
Okay.
And the second in the skin regimen goes your vitamin C. Vitamin C is something you should keep applying.
It's again
Vitamin C
good for
serum.
collagen as well.
Yes, so vitamin C serum, it will help in preventing the sunspots. It will help in treating those sunspots if they have appeared, and it's going to not irritate your sensitive skin type. Third, if your skin is prone to acne, there is only one antibiotic cream, which is clindamycin, that you can apply. You have to go away with any retinoids which you have been using previously on the skin, because after pregnancy they are a strict no-no. And hydration
And
again.
why is that the case? Is it something that, okay, I shouldn't
So it
ask
has
this
been
question.
studied that it is not good for pregnancy.
Okay, let's not get it.
Yes, and
too
it
many
can get,
details.
yeah. So retinoids are a strict no-no. You can go back and check if you are using any product which has retinoid, that has to go away.
So perhaps
And
when you get pregnant, like you said, you visit your dermatologist, but you also
Yes.
sort of recheck all the creams and your general regimen, maybe the
Yeah.
ingredients, so you know what you're putting
yeah,
on your
and
skin.
if you're getting acne, if you're getting pigmentation, go to your doc again and check with him or her to give you some treatment. There are certain mild peels which can be done during pregnancy.
During pregnancy, okay,
which
I
can
didn't know
help
that.
in maintaining your skin refreshed, which will help taking care of those sunspots. But these are very mild peels to be done only by the doctor or the doctor's supervision.
Okay,
Yeah.
great. Doctor, what about, I mean, you've tried all the preventive measures that you mentioned, but you still end up getting your mask of pigmentation or your acne, which is later, acne marks as well. Is there something you can do post-pregnancy?
Yes, so there are loads of treatments available post-pregnancy. We do a wonderful treatment with a Q-switch laser to remove that pigmentation. Thankfully now, because of all the medical advancements and the knowledge known to us, that pigmentation can be taken care of. With that deep pigmentation of the sunspots, there are laser treatments available which are Q-switch laser based, which just blast off the pigmentation. And there is
Blast
no
off the
doubt.
pigmentation.
Yeah, so that might
sounds
sound
amazing.
a little scary also.
It sounds amazing actually, like you just blast it off your skin.
Yeah, and
it does
there
not
is-
exist anymore.
And there is no downtime to it, Nadia.
Oh, really? So you just
So-
come out of the clinic looking
Yeah.
amazing.
And you can go back home, no one has to know, you can go out party, you can put on makeup, that's it. Once in a month, that's all that you need. And for acne, which have become acne scars now, there's another sort of a treatment which is again laser based to resurface the skin and bring back that smooth, glowy skin.
Okay, and I'm guessing that you just need a couple of sittings each.
Yes, about
depending
4 to
on how
6
bad it
sittings.
is.
Yeah.
Okay, that brings me to another concern, which is a concern for me still, is not having like the pregnancy pouch and not being able to have your stomach exactly the way it was before having a child. Everybody's obviously working out, you're trying to take the best nutrition possible, but is there something that, if there's a little bit, is there any help that we can offer treatment-wise?
Sure. That you look perfect, Nadia. But
Okay, thank you.
that's a little pregnancy pouch, because I've had 2 babies and I had cesarean both the times.
Okay.
So that was always my concern. What will happen to my weight? What will happen to my belly? And on top of that, me being a hypothyroid patient, it wasn't easy to lose that fat and then lose those inches and get back into shape. So there are treatments available, and these are all FDA approved. So when I say FDA approved, that gives me a lot of privilege in saying that yes, they actually work. They're not just regular treatments which are available which say, oh my God, we can make you lose so many inches, or we can make you drop that many weight. It is actually something which is effective.
Yeah, a
and
person's
has
always
been-
skeptic, like will
Yeah.
it actually happen or will
Yeah.
it just sort of come back?
Yes. So I encourage my patients, these are FDA approved treatments, go back up, do your homework, and you know that they actually work. So first treatment that we do for that stubborn little belly pouch, which is staying there post your pregnancy after you doing Pilates, taking care of your diet, we do a treatment which is called fat freeze. It's also called cryolipolysis. Cryo meaning cold.
Cryolipolysis.
Yes. So cryo meaning cold, lipo meaning fat, and lysis meaning breakdown.
Okay.
These are all non-surgical procedures which don't have
So no
any
invasion.
invasion, no
Okay.
injections, no surgery. You're good to go back home post the treatment. Sometimes a woman who has been taking a well-balanced diet and has a good nutritional profile, we would just need one treatment. And
Wow,
then-
just one treatment.
Yes. So what
And it's
that-
gone?
Yes, it's gone. It's going to be a treatment for about 60 to 70 minutes. You will feel numbing at first because that's the vacuum which is sucking in the fat. And slowly the temperature will drop down to about -6 to -7 degrees. That is the time those 20% of the fat cells are being targeted to freeze. And once they're frozen, no magic will happen all of a sudden. So we don't say that post the treatment you're gonna like fit into your black dress. It will take at least 60 to 90
So it's
days.
gradual. So you've had your treatment and then slowly the fat freezes and goes off wherever it does.
Exactly. So 60 to 90 days is the time taken
Yeah.
for those fat cells to get drained out of the body. It will get drained from your urine, your feces, your sweat. So patient selection is the key. I would want to select a patient who is motivated enough to have a good balanced diet and is also having some side of a fitness routine, and not just coming in that,
That's the secret. So now we see all these like celebrities with washboard abs, So that's how you get them,
Yes,
right?
we have to work as a team together.
With your workout and nutrition, of course. You can't. There's no cheating that. But
because what we are doing is only reducing the fat and the inches. But what you are doing at home with the diet and the fitness
keeping
routine,
active,
you are losing the weight. We are only working on the inches and the fat.
It's a spot reduction, which sometimes becomes a little bit difficult. So that's where you come in and help.
The stubborn pockets of fat. So even with people who are really fat and obese, and I've seen those women who just lose hope that, doc, we can't lose any of it. I've been trying to do, but then I go back to it. So we have another treatment for that, which is using heat in the form of ultrasound energy to liquefy that big amount of fat.
So this is like an advance for people who want more fat reduction.
So my treatment choice depends on the kind of the patient and the kind of their lifestyle. We have a good conversation with them. I do a full elaborate consultation where I understand that what is their requirement, what they're aiming at.
Perfect.
Yes.
Okay, now I want to ask you, what is new in new mother care? What is everybody getting out there to look amazing? So what are the new treatments on there?
So for new mother care, as we call the new mommy makeover, there are loads of treatments. So let's start with the most not talked about thing, which is vaginal tightening. So there's an FDA approved treatment for vaginal tightening. As women are gonna have more babies, the vaginal laxity goes for a toss. Women start to have some dribbling of urine and they start to feel that their vagina
incontinence,
is not tight
which I think
enough.
a lot of people
and they don't want to talk about it too much. Usually you'll go to your trainer and they'll talk to you about Kegel exercises to make your pelvic floor more stronger. But there is a treatment available now.
Really?
And it's an FDA approved treatment. So it's done once in a month and you need at least 4 sittings, which is like 4 months. And my patients are really happy. I've been doing this treatment for almost a year in my center and I would say my success rate is 100%. So yeah, so it's vaginal tightness 1.
And one question, that sounds like is it a painful treatment?
Not really.
Okay.
Not really. But yes, some heat that you should be primed enough and that heat doesn't feel bad.
Okay.
Yeah. And the second thing now we talk about is breast. So during lactation, when you're gaining weight, losing weight, it's very difficult to have that perkiness alive still. So the breast sagging is something which I've seen very regularly in my patients. We have treatments which have radio frequency in them, which helps the collagen tighten up and rejuvenate. Because what happens slowly and steadily, the collagen starts to break down and that causes the laxity. We need to give energy to that collagen to start tightening up. So we have certain FDA approved procedures again. We have been doing a treatment called Exilis, which has been, it has been widely spoken about on the internet, internationally marketed, and it works wonderfully again. You will feel only heat. We do it once in a month, once in a week, or at least 6 to 8 sittings depending on the patient representation. And again, my patient is very happy and the success rate would be between 80 to 100% because patient selection is again the key, and the amount of damage is also something that we have to see, that how much bulkiness is there and how much we have to give the energy. Sagging breast is my second concern. A lot of patients post-pregnant and even otherwise come with saggy breast and they actually don't know what to do about it.
Sounds so weird.
Yes, it's weird and natural, there you go. So we have been doing this treatment for almost 4 years now, and I can see I must have treated so many women with it and they are quite happy. So what happens? Once you're lactating and you have gained so much weight and slowly
it's like a balloon, and it's the same thing with the stomach.
Yes, and when the breast tissue is going back into its place, the sagginess happens. So the treatment that we do here involves radio frequency. So radio frequency, when it's applied to the tissue, it's going to help the collagen regenerate. It's also going to tone up the muscle and lift up the breast. It feels like heat or
5 in 1.
Yes. And it will feel like a hot stone massage. You will not feel uncomfortable during the treatment. It's almost a 1-hour procedure done once every week for at least 6 to 8 weeks total. You will start seeing results within the first or the second sitting. So this treatment has been working wonderfully. I've had such a success. I would say my success rate is about 80 to 90%.
Wow.
Yes, and women are coming in, getting all...
So the new treatments sound amazing, incredible, and it's all non-surgical, so non-invasive.
Yes.
Doctor, for the fat freeze, is it only for the belly, or if you have other areas, spots of concern, can you use it for a different body part?
So fat freeze can be done for actually any of your body parts wherever there is fat. So I usually tell my patients, if you can squeeze it, we can freeze it. So be it your thighs, be it your bra fat, be it your love handles. In fact,
so anywhere?
Yes, in fact, we are also doing it for your double chin. it can be done for there, and it can also be done for your arms, the upper arm, and hat. And also women who want that thigh gap, because that's the intent to make each body perfect, the inner thigh gap.
Yeah.
So yes, if you have that bulge, we can do the treatment over there.
So you walk out of your clinic looking like Kim K.
Oh, yes, that depends after some time if you follow the instructions. Why not?
Also, because it's called fat freeze and it's for 60 minutes, is it uncomfortable because it's a long treatment?
So I'll take you to the treatment. So once I've assessed your body part and we exactly know how many sessions you need or how many applicators you need, we make you lie down, we change you into comfortable clothing, and we measure the amount of fat. Then we put a sheet on top of it to protect your skin from that low temperature.
So it's just like portion by portion.
Yes, so if I'm doing your tummy, I'll put a sheet over here, and then slowly the applicator is placed. So initially 2 to 3 minutes you will feel only vacuum, because that is the time when the fat is getting sucked inside. And slowly when the temperature is dropping down, you will feel numbness to the treatment. And it is quite comfortable for those 60-70 minutes. You can work on your phone, you can talk on your phone.
So I can go about doing whatever I want.
Absolutely.
So
So 60-70 minutes, very comfortable, because there's extreme numbness during that treatment, and that too only on that area. Post the treatment, we get an ice lolly. So
ice lolly.
Yes. So the way you put your hands inside ice cold water, it gets all crinkly and ice lolly.
It is not to eat.
Exactly, it's not to eat. So that is the kind of appearance that fat is frozen. So that portion will look like the frozen ice lolly.
Okay.
You massage it back into your body. So that is the time which actually feels a little funny to someone.
Okay, so it's actually frozen
Yes.
pockets.
So one of the technicians or the doctor would be just massaging it back into the body. You feel kind of funny because the area is numb and very cold, and we are just massaging that area. That happens for about 4 to 5 minutes, and post the treatment, you're good to go back home.
Are there any side effects to this treatment?
So side effects to this treatment, post the treatment you will feel numbness on that area because it has dropped down to -4 to -7 degrees. You might feel some redness and some swelling, which will go off within a period of about 2 to 3 days and maximum a week. 2 out of 20 of my patients also feel some spasmodic pain around their belly area, but that is like a menstrual pain or spasmodic pain, which also goes off in 2 to 3 nights.
Okay. So it's not a very long downtime.
No, nothing. You can go back home, you can go party. Nothing to worry.
Thank you, Dr. Geetika, for coming and sharing all this amazing information with us. It was very enlightening. If you have some questions that we missed out, if you guys want certain concerns addressed, please comment below. And if you've liked this exchange, please subscribe and share the video.